Well, thank you for joining us in our ongoing series on preventative services. My name is Karen Curtis, and I am a Provider Outreach and Education Specialist at WPS Government Health Administrators. I'm joined today by my friend and coworker, Mary Sue Gardner. Mary Sue will be helping me out today by adding additional information in the chat and also monitoring it for any questions that you may send in. Preventive services has been listed on multiple surveys as a topic that you would like to see in future education. This series has been broken into clinical presentations that have been done by my coworker, Jennifer Boniface, and billing presentations that I have been doing. So Jennifer's presentations have been covering more of like the National Coverage Determination or NCDs and the documentation guidelines. Well, I've been talking more about what you should be including on your bill when you send those into Medicare. In the past, I've typically covered one service per webinar, but today will be a little different. I'm going to be talking about both cardiovascular disease screening and intensive behavior therapy for cardiovascular disease. This next slide is our disclaimer. We do our best to provide the most current, accurate information, but as we all know, Medicare rules can change often. The information that I am presenting is accurate as of today, but the CMS website should be checked often for updates. CMS does prohibit the recording of this webinar for profit-making purposes, so we ask that you don't record the presentation. We are recording this and we will post it to the WPS GHA website on the Encore Presentations web page as well as our YouTube channel. Today, I'm going to give you a little background information on preventive services. We'll talk about how to bill for cardiovascular disease and intensive behavior therapy for cardiovascular disease. And finally, we'll discuss how to check eligibility to determine if the patient is qualified for coverage. I did notice that we are getting some frequency rejections on claims, so I want to make sure that I can show you how that can be avoided. My hope is that at the end of this webinar, you'll have a better understanding of how to bill Medicare for preventive services related to cardiovascular disease. Let's talk a little bit about the Affordable Care Act and the U.S. Preventive Services Task Force. The Affordable Care Act and U.S. Preventive Services Task Force, or Task Force, has helped make preventive services more accessible to beneficiaries. The Affordable Care Act was signed into law on March 23, 2010. It required health care plans to provide certain services, immunizations, and screenings without cost sharing. The hope was to eliminate some of the out-of-pocket expenses so that more individuals would be open to receiving preventive services. The Act also increased accessibility to services by making it unlawful for any healthcare providers who receives federal funding to refuse to treat individuals based on race, color, national origin, sex, age, or disability. The task force is a volunteer group that was created in 1984. The 16 members consist of national experts who come from a variety of fields, including family medicine, behavioral health, and nursing, among others. These individuals make evidence-based recommendations regarding preventive services offered in a primary care setting or services that are referable by a primary care clinician and apply to patients who have no obvious signs or symptoms of a specific disease. Each service is reviewed to determine if there is evidence that the service is effective and the balance of benefit versus harm. A letter grade is then assigned, and those that receive a grade of an A or a B are offered without cost sharing. Cardiovascular disease can refer to many conditions. Some of the more common ones are heart disease, heart attack, stroke, and heart failure. It is the leading cause of hospitalization and death in the United States for both men and women. Many of these deaths are due to heart attacks and strokes, with 1/3 occurring in people under the age of 70. Cardiovascular disease is also very costly. In 2019, $239.9 billion was spent in healthcare, medicine, and loss of productivity due to death. The CDC estimates that 805,000 people per year have a heart attack. Of those, 605 are first heart attacks, and that means that 200,000 occurred in individuals who had already suffered a heart attack. As we look at the risk factors, you may notice that there are preventive services associated with many of these. High blood pressure is monitored during the annual wellness visit. Medicare covers counseling to prevent tobacco use. There are multiple services that are available for diabetes, such as screening tests, self-management training, medical nutrition therapy, and the Medicare Diabetes Prevention Program. For overweight patients, intensive behavioral therapy for obesity may be an option. And lastly, patients with excessive alcohol use may benefit from the alcohol misuse screening and counseling services that are offered by Medicare. The first service I would like to discuss today is cardiovascular disease screening. These screenings include blood tests for cholesterol, lipid, and triglyceride levels. The results can help determine if the patient may have conditions that could lead to a heart attack or stroke. This service is covered for patients with Medicare Part B who do not have any apparent signs or symptoms of cardiovascular disease. When submitting claims, you'll want to include HCPCS or CPT codes 80061, 82465, 83718, and 84478. You're also going to want to include diagnosis code Z136. This screening is covered once every 5 years. The internet-only manual specifically lists once every 60 months. So when calculating the frequency, you're always going to want to start with the month after the service was received. So let's say, for example, that the patient had a screening test done in January of 2024. You're going to start counting the 60 months in February, and that would mean that their next eligible date would be in January of 2029. Next, we'll move to intensive behavior therapy for cardiovascular disease. This therapy is meant to help patients lower their risk for developing cardiovascular disease. Therapy consists of 3 components. The first is encouraging aspirin for primary prevention when the benefits outweigh the risk. Male patients should be between the ages of 45 and 79, while female patients should be between the ages of 55 and 79. The second component is screening for high blood pressure if the patient is 18 years or older. Next would be promote a healthy diet. This component is relevant to the majority of the population and is widely recommended. The last bullet on this slide is a requirement more than a component. So according to Medicare guidelines, services must be furnished by a primary care physician or practitioner in a primary care setting. So I'd like to provide some clarification on this requirement because in the past I've noticed that it can sometimes lead to questions. So for the purpose of this service, emergency departments, inpatient hospital settings, ambulatory surgical centers, independent diagnostic testing facilities, skilled nursing facilities, inpatient rehabilitation facilities, and hospices are not considered primary care settings. For a primary care physician, this means a physician who is a general practitioner, family practice practitioner, general internist, or an obstetrician or gynecologist. A primary care practitioner is a physician who has a primary specialty designated of family medicine, internal medicine, geriatric medicine, or pediatric medicine. It can also be a nurse practitioner, a clinical nurse specialist, or a physician's assistant. When submitting claims to Medicare, you'll want to include code G0446. No specific diagnosis code is required, so you'll want to use a code that's consistent with the patient's exam. This service is covered annually, which means that 11 full months will need to have passed before the beneficiary is eligible to receive another therapy session. Coinsurance and deductible do not apply to the service. If you bill on a CMS 1500 or an 837P, there are some additional requirements. The claim should include a place of service shown here. So we have an 11 for the physician's office, 22 for outpatient hospital, 49 for independent clinic, and 72 for rural health clinic. Claims that are not submitted with one of these places of service will be denied. Here's a list of the specialty types that can bill for intensive behavior therapy for cardiovascular disease. Some of these were included in those definitions that I gave you earlier. Claims containing any other specialty type will be denied per CMS instructions. If you are a provider who submits claims using a UB04 or an 837I, services should be billed on one of the following type of bills. So we have a 13X for hospital outpatient, 171X for rural health, 77X for federally qualified health centers, and an 85X for critical access hospitals. I'd like to take a little time now to go over the different options for checking eligibility. This is the best way to avoid having your claim reject with frequency edits. So eligibility for services discussed today can be found using the options shown here. We have the interactive voice response, or the IVR, the secured section of the WPS GHA website, which is also known as the portal. Providers who use the Fiscal Intermediary Shared System, also known as FIS, can use direct data entry, or DDE. And lastly, the HIPAA eligibility transaction, also known as HETS, can provide dates to let you know when the beneficiary is eligible to receive the services. So the first option here is the IVR. We have been told by customer service and some providers that this is not their favorite option. I've listed instructions here. And one thing that customer service management has stressed is that you don't have to type in everything. You can just talk and say eligibility, say preventive services, and the system will take you to where you want to go. I had a provider recently say that every time that she pressed 0, instead of taking her to a live or a live person or a department, it was taking her to the survey. There are some changes being made so that hopefully that doesn't happen in the future. But just so that you know, this is an option. You can talk to it instead of pushing buttons for everything, and it should take you where you need to go. The interactive voice response will provide procedure codes, and it will give you the next eligibility date for when those services can be provided. Our portal will also provide information on preventive services eligibility. The eligibility check is found under My Transactions. After entering the patient's information, you'll provide the date of service, and then you'll go and select the tab titled Preventive Services. That will provide you with the next eligibility date. Excuse me, I kind of have a frog in my throat. For providers who bill using the Fiscal Intermediary Standard System, or FIS, direct data entry is an option. You would go from the main menu, you would choose option 1 for inquiry, and then choose option 10 for beneficiary common working file information. So I've taken a printout from the DDE manual and put it here so that you can see it will list the preventive services. It gives you the HCPC codes. It tells you the technical date and the professional date. And then it also does have a section for the intensive behavior therapy, and it will give the next eligibility technical and professional date for those services. The last option would be HETS. This, you do have to register as a trading partner. Providers will submit a 270 inquiry and they'll receive a 271 response that will give the next eligibility date. I've included a couple examples of the transaction here. So if the technical and professional component have the same next eligibility date, it shows up as one line, which you see on top here. If there are different dates for those components, then the response will break it out into 2 separate lines for you. I have provided you with some resources. I do want to take a minute to go out and show you the first one that I put on here, the educational tool for the Medicare Preventive Services, I think is really helpful regardless of what type of service that you are billing for. So we'll go out there real quick. Mary Sue, can you confirm that you can see the Medicare Preventive Services tool?
Yes, Karen, I can see it. Thank you.
Okay, thanks. So if we go down right here to the quick start, this is an educational tool provided for Medicare billing. It provides national coverage determinations if it's applicable to that service, and it will give you a link to that. It tells you what HCPCs and CPT codes should be billed. There's a little clock. If you see that on one of the services, then it's prolonged preventive services information. If there's a required ICD-10 code, it will give that to you. It lets you know if it's eligible for telehealth. It gives coverage requirements, frequency requirements, and patient cost sharing. So as an example, if we go to the cardiovascular disease screening, it has the national coverage determination right here. This will provide you a link so that you could go directly to that. It lists the codes that should be billed, the diagnosis code. It tells you when Medicare will cover it, the frequency, and what the patient pays. If you scroll down a little further, it also has a preventive services checklist that's available for physicians to give to their patients. And this can kind of help them keep track of what services they're eligible for, what they've already gotten, what they need to get. There's a space here where they could maybe write down appointments or when they're next eligible to receive the services. So that's just something that would be helpful for beneficiaries. I also want to bring up the Medicare publication 100-4, which is the claims processing manual. It does list in here, CMS does, I think, does a good job of breaking down the requirements. They break it down for if you're a Part B or if you're Part A. Now, the cardiovascular disease screening was pretty straightforward, so there really weren't any differences for the Part A versus the Part B. But there are times when, like for the behavioral therapy, it does split it and tell you what places of service are required or what type of bills are required. And for Part A, if you're a rural health clinic or if you're an FQHC, and if you should be billing differently, it'll give you a section of the RHC and FQHC manual. It will refer you to that so that you know where to look for those different guidelines specific to your facility. Okay, Mary Sue, have we gone back to the PowerPoint?
Yes, you have.
Okay, thank you. Okay, so since I did receive a pre-submitted question, I'd like to answer that before I go to Mary Sue and see if there's anything that's come through in the chat. The question that I got was regarding the time for code G0446. So the question was, is there a midpoint or does the entire 15 minutes need to be completed? So I did a little research. I looked at the NCD and I also looked at the internet only manuals, and I couldn't find where CMS addressed the time. And so in these cases, it's safe to assume that you would need to meet the midpoint per the CPT guidelines. If CMS has specific guidelines, then you're usually going to find something either in the NCD or in the internet only manual where they're going to use wording such as like if they said up to 15 minutes, then that would mean that any time spent for that particular code could be billed. Other times they may say a minimum of 15 minutes. So of course for that, you would have to meet the whole 15-minute requirement. Now you are going to want to make sure that when you document that you are supporting that those components were addressed. Now the aspirin use may not be applicable for everybody, but the blood pressure screening and the healthy diet would likely apply to most patients. So you would just want to make sure that you have that documentation. So now I'll turn it over and I'll ask Mary Sue, have we gotten any questions come in on the chat?
Hi, Karen. Ironically, the only question that came in was pretty much the same question that you answered, and I answered that individual that asked it in the exact same manner. So I basically just said, in order to bill these, the record must show that the service took over half the threshold time, or 7.5 minutes. So that's the only question that came in at this time.
Great. Thank you for that. This brings us to the end of today's presentation. I want to let you know, since we have had some requests for education regarding the Recovery Audit Contractor, or RAC, we are going to have an upcoming series. WPS will be partnering with Performant, who is the RAC for Region 1 and 2, to deliver a 3-part series that is going to help providers navigate the RAC process. So the first webinar will be held on March 21st, and we should have that posted to our live events page next week. Next week, we're also going to be holding webinars on modifier AT, along with MSP and SNF consolidated billing. So if that's something that interests you, there's still time to register. On behalf of Provider Outreach and Education, thank you for joining us today. We look forward to your survey comments and hope to have you join us for future events. You may now disconnect.